much, Dr. Bergeron. Our next speaker is going to be Donna Broshe, and she's an associate professor here at the University of Virginia, and she's co-director of the Neurocognitive Assessment Lab and also associate director of the Brain Injury and Sports Concussion Institute here. She provides clinical services and consultation not only at the University of Virginia Athletics Department, but also to many local high schools as well. And certainly within the media, sports-related concussions have been the most common sports medicine topic addressed in the national media. And I'm excited to have Donna here today to talk about sports concussions in children and adolescents. Please join me in welcoming Dr. Broshe.
So I want to thank Jay for inviting me to be part of this conference. I think it's just a really excellent thing to focus on youth fitness. And also thank you to Ellen Daniels and Crystal Hayslip for their many emails to get us all organized. I'm going to talk today about, let's see. Pardon? Right arrow. Thank you. Would have been good if I checked that out before I got up here. So I'm going to talk a little bit about the current emphasis on concussions, about why we're as concerned about that now. Briefly define concussion and talk about the symptoms. Talk about the emphasis on individualized concussion management, when to refer, the issue of temporary academic accommodations when people are recovering, and very importantly, the return to healthy physical activity. So, sorry. Wow. Thank you. Okay, so we're going to talk about sports concussions, and just as a reminder, sports concussions are not just about football. They're not just about contact sports. They're not just males that get concussions, not just adults, and it's not just organized sports. So concussions can occur in all kinds of venues, and today we're going to be mostly talking about sports-related concussions. Although some of this will apply to people who get mild brain injuries or concussions from other mechanisms. So one of the reasons there is an increasing emphasis on concussion safety. So you've all heard about the issues in the NFL, and one of the things that's happened is the NFL has gone from totally ignoring concussions to making this a very big issue. Not necessarily because it was their idea, there was a class action lawsuit as well, but regardless, there's been a very big push on safety. But sadly, a couple of the things that have pushed this forward in the pediatric population are deaths. These deaths still occur. A colleague just sent me an email. A young man, a high school football player in New York, died last week from a concussion sustained in a football game. So this still happens. But in 2004, Jake Snakenberg died from a sports-related brain injury. And finally, in 2012, Colorado passed a concussion safety law named after him, and it actually mandates concussion education and management in all public schools, but also all private schools in the state, Pop Warner leagues, any kind of recreational league. So this is one of the most far-reaching statutes in the country to protect youth athletes. The person who's probably gotten the most publicity is Zachary Lystad, and you can see him here. He was a multiple sport athlete. His dad was his coach. He was playing in a high school football game, had a mild concussion, rested 15 minutes, and he was sent back into play, into the football game, and he got another hit, and he had a devastating injury. He actually was intubated, he was hospitalized, he had many, many hours of rehab, and eventually he was able, with some assistance, able to walk across the stage for his high school graduation, but he still primarily gets around by wheelchair. The Lystad law is the model for most of the laws in the country to protect youth athletes. I'm very pleased that Virginia has a law. This was implemented in July of 2011, and Vanessa Wyden, sitting over there, and the Department of Education were instrumental in gathering a group together to flesh out the state law. But the basics are that it mandates concussion education in public high schools. This does not apply to private schools, nor does it apply to recreational leagues. The athletes and their parents receive annual education, And most importantly, any athlete with a suspected concussion is removed from physical activity, and they do not return the same day. If they have a concussion and it looks like they recovered, they still do not return the same day, and that's critical. They also must be evaluated by a healthcare professional before they return to activity. They have to be asymptomatic before they begin a Zurich protocol with return to activity, and we'll talk a little bit more about that in a minute. And it also requires a written clearance for return to physical activity. So you can't do a little okey-doke. There's a concussion, they have to see a healthcare provider and have written clearance. So what is a concussion? There's a lot of misinformation, and a lot of people think a concussion requires a loss of consciousness or that you have to have a blow to the head. But what it is it's a very complex pathophysiological process affecting the brain, and it's induced by a biomechanical force. So it can be caused by a direct blow to the head, but it can also be caused by a direct blow to the body that transmits forces to the brain. It's typically a very rapid onset, and it's transient, short-lived neurologic symptoms, usually resolve spontaneously. However, in some cases, the symptoms and signs can evolve over a short period of time. It results in functional changes, typically not structural changes. So when you have imaging, CT, MRI, typically you're not going to have positive findings because it's more of a functional disturbance. And again, there may or may not be loss of consciousness, and only a small percent of people have a prolonged post-concussive syndrome. So the symptoms tend to cluster. There are multiple domains. So there are the somatic symptoms. These are things like headaches, nausea, dizziness, light and sound sensitivity. Sleep disturbance, which can be a very significant issue, and that's often insomnia or hypersomnia. There are mood issues, irritability, mood lability, decreased frustration tolerance, and for some people, sadness or anxiety. A lot of times parents say, well, that sounds like my teenager all the time, so how can I tell the difference? Well, so keep in mind the baseline. Do they seem like they're doing more of that than they were before? And then, of course, as a neuropsychologist, one of the things I see a lot of are the cognitive symptoms. A lot of people report sort of a foggy feeling, like their brain just kind of working through molasses, kind of slow thinking, their brain gets tired easily, it's hard to process information. And we also see inattention and memory deficits. So acutely, what you typically see is a lack of awareness of surroundings and that sort of acute confusion. You might also see nausea or vomiting, headache, amnesia, dizziness or vertigo. So this is sort of the immediate symptoms. So I'm just going to show you a couple slides on what's going on within the brain. And one of these is the pathophysiology. So one of the really important things, as I mentioned, you don't see structural changes, you're seeing neurometabolic changes. And what you can see is that at the time of injury, there is a mismatch between the brain's demand for glucose. The injured brain is trying to get more glucose to get back to homeostasis, and the body cannot deliver it. So the brain is saying, send me more glucose. The body's saying, I can't even get you the normal amount. So there's a significant problem that affects the metabolic need for oxygen. This is a very complicated slide, and it's just to show you that what happens in concussion is at the cellular level. Again, it's a neurometabolic cascade. Essentially, potassium is rushing out of the cells, calcium rushes in, and it creates an energy crisis within the brain that affects the basic energy ATP production. So I want to talk a little bit about, obviously, pediatric concussions. So what we know is that most research on concussions to date has been conducted at the high school or older level, college level. And so we know that in college athletes, it takes about 5 to 10 days for a full recovery if there's a simple, uncomplicated concussion with no previous history. Kids take longer. Kids can take 30 days to recover. So it's very important to be more conservative with younger athletes. There's some research that shows that the incredible variability in recovery in the adolescent brain. And what you can see in this slide is the very dark bars on the far left shows those athletes who recover in under a day. And by recover, it does not mean they return to play. It means they're reporting they're no longer symptomatic. So you can see there's a pretty large percentage of kids who have concussions. They have this very transient event and they are not symptomatic quickly. But what you can also see is that where the arrows are is the very large number of kids for some sports whose symptoms are persisting more than a month. So the really important thing to know is that there is tremendous variability in recovery. So nobody should ever use any kind of cookie cutter, one-size-fits-all return to play or return to activity criteria. Individualized concussion management is very important. So this is the Zurich statement, and I know at least that table over there, where Shelley is sitting, are very familiar with this. This is really the state, it's based on clinical consensus, but this is the gold standard for returning people to activity after concussion. And the idea is that once you're basically asymptomatic from your concussion, then you start the next step, which is stage 2 of light aerobic exercise. The idea is to gradually introduce exercise to see if you increase symptoms. With exercise, you start to increase heart rate. The next step, you add movement, and then you start to increase the cognitive load in addition to those things. And the idea is to see if somebody's fully recovered, they can handle each subsequent step. But if they're not fully recovered, increasing the heart rate or increasing the complexity can actually bring on the symptoms. You know they're not recovered. You have them go back to the previous stage and kind of start from there again, give them some additional rest. I actually just spoke last Friday in Northern Virginia, and pediatric neurologist was there, Chris Giza, who co-authored the AAN criteria. And he said rather than 24 hours minimum at each step, which is what we do with college and older, he said with pediatrics, younger kids, he may hold them at a minimum of 48 hours at each step. So the AAN Guidelines, this is the American Academy of Neurology, finally, after many, many years, they just revised their guidelines, which was very critical because so many people rely on these guidelines for their concussion management. So these were evidence-based. They reviewed all existing literature, and the primary points of their guidelines is that, similar to what we've already talked about, immediate removal from play if the concussion is suspected, and they've moved away from concussion grading systems. So nobody should be saying it was a grade 1, grade 2, grade 3 concussion. That is not the current state of the art, because again, we're focusing on individualized concussion management. And there's no set timeline for return to play. Again, it's based on the individual symptoms. And a very important issue is that concussion is a clinical diagnosis. So concussion, presence or absence of symptoms, or recovery should never be based on one tool. Some people use computerized cognitive tools as an adjunct to their clinical exam. That is part of your clinical decision-making process. Similar to our state law, there's no return to play until assessed by a licensed healthcare professional who is trained in concussion. There are lots of professionals. Not everybody is aware of concussion management, so it's very important that whoever that is providing the clearance has some expertise. Again, return to play slowly. High school and younger need to be managed more conservatively. And a very important thing is that the first 10 days after a concussion is the period of greatest risk for another concussion. So you really want to keep them safe those first 10 days. So we're going to talk briefly about cognitive baseline testing, which many of you are aware of. And this is the idea of using a computerized test or using an exam like a SCAT-2 to see what people are like before a concussion. The reason that's important is because sometimes concussion symptoms are very subtle. And if you don't know what somebody's like beforehand, it's hard to figure out what they might be if they're symptomatic after a concussion. And just with Bart and Lisa Simpson, Lisa being a straight A student and good at everything, and Bart not so much. If Bart had a concussion, how would you know if he had recovered? Because he may never get to Lisa's baseline, which would be much higher. So this is just an example to show you how that kind of testing can be helpful. This is an example of a 16-year-old girl who had a concussion, And this is based on the Concussion Resolution Index, and on the far left, you see what her baseline data looks like. So she's kind of like Elisa Simpson. She's very bright, high average abilities, and that's simple reaction time, complex reaction time, and processing speed. She then has her concussion, and you can see that her scores in simple reaction time and complex reaction time drop dramatically. Okay, so she's very symptomatic at that point. And then as you can see, going to day 8 and day 9, she's starting to recover. But at day 9, if you did not have her baseline data, you would think she's recovered. Because at that point, she's in the average range, 100 is average, she's just right in that average range, and she would look like she was recovered. But because you know that at baseline she's a high average girl, you can now see that she is still symptomatic. So with a little extra rest, by day 14, she is back to or above her baseline, and she's demonstrating recovery. So briefly, with neuropsych testing in sports concussion management, there's a very big difference between what we do in the office and what people do to sort of manage simple concussions. We do a very complex interview, significant testing. Typically, you only need to refer to a neuropsychologist if there's a complicated recovery. If it's a simple recovery, that can be managed very well by other healthcare professionals. Typically, we recommend that not only prolonged symptoms get referred, but prior concussions, seizures, complicating factors like migraines, ADHD, a protracted recovery course. It may be a student who might need a 504 plan, psychological overlay, and then any decisions about retirement. Just briefly, if an athlete who is in school has a concussion, they're going to need some temporary academic accommodations. And I'm going to speed through this, but it's all in the handout that you have. Obviously, if you can't think straight because of concussion, you're going to have a hard time with school. So it's very important to minimize some academic demands. Rest, they may need a day or two of excused absences, then they may need some extended deadlines, or have some of their tests delayed or staggered. They may need a reduced workload. The other thing is that they may need a modified environment in school. Bright lights are often problematic, noisy hallways. They obviously would need to be excused from physical activity in gym. So there are lots of different accommodations that can be done. Everybody here is aware of the benefits of physical activity in sport. This is just a summary slide of areas of multiple literature. What we know is that kids who are held too long from recovery, or for the recovery period after concussion, often have iatrogenic effects. They start to have very complicated recoveries because they're held from exercise too long. This is a study where they took kids who had prolonged symptoms and they started them under the supervision of medical professionals to exercise them in that graduated way, and they all showed a rapid improvement in their symptoms. Exercise, it can now be used as a treatment for TBI. What we've discovered through animal research and human research is that you absolutely have to rest in that acute period after a concussion. So in those first few days after concussion, no physical activity whatsoever. But then you need to get the exercise happening. And again, not putting them back in sport, not putting them back in competition where they might get another concussion, but walking. It needs to be active recovery. Exercise after a brain injury, once you're beyond the acute phase, increases the brain-derived neurotrophic factor, which is a chemical which actually improves brain functioning and actually enhances cognitive recovery.